What's happened in the NHS is we've gone from quite individualised CCG setting, which had focused in on their own particular areas and were focused on their own challenges. Now, often those related to financial challenges and health challenges, but as the organisations have come together into ICBs, one of the big challenges that ICBs have got is to try and challenge health inequality. Core 20+5 is really important within that. The reason you get inequalities is often because within a ICB setting you've got areas of high wealth and high deprivation, and each one of those areas are going to require a different input in terms of the care they need, whether that's preventative care or treatment. Often what happens is patients turn up and kind of present with their issues, but equally, based on the local factors, patients or communities may not necessarily believe that healthcare is the right thing to get. Particularly in high deprivation areas, you get issues around smoking, etc., high weight as well. So trying to manage all those things is really important in terms of a whole system setting. All those things impact ultimately on healthcare and how patients are managed within the setting and where patients go to get access to care, whether patients turn up at A&E, whether patients turn up at the GP, community pharmacy, etc. It's important that we know our local populations, and it's important that we know how best to engage with those local populations within your overall footprint. And that's the challenge within health inequality. So it's understanding the key local drivers for the populations and the communities, how to engage with them, and how best to either outreach to them or them to reach in, whether that's through locally set up clinics, whether that's through community pharmacy, whether that's through general practice or hospital or community care in some other setting. Community pharmacy are often the kind of key point of contact for patients in their local population, so it's important that we engage with community pharmacy to support their patients and the population as a whole. At community pharmacy level, we will normally work with them to let them know that we've got a medication review ongoing in the area, the type of review we're doing, so that they understand the patients that are involved and the medications involved, so they can prepare both from a understanding of any changes that are happening and a stock level perspective as well, and support their local patients in terms of any questions that might come through during the review process. Within all of our review services, we always do undertake a stakeholder map just to make sure that we've identified the key stakeholders and that we can allow them to input into the review service where appropriate. That helps us reduce inequalities within any of the reviews we undertake by making sure that we've understood the local requirements, so the stakeholders can feed into the review service and make sure that we've factored in local issues. So within the review services that we roll out, we always work within the local ICB and place setting to understand what the local challenges are, so whether there's language challenges, digital challenges, etc. And we will work with place leads and understand what the local population requires. So when we do our reviews, we're trying to tailor it to the local population and work within the setting to make sure that we give the best patient outcomes.